So, good morning. So my dog story is that, and it's a healthy dog story. We lost our Labrador Retriever at 17 years and 9 months. So that's a pretty good record. So I was feeling good about that. So the family debate is whether we get another dog. So thanks for being here this morning. I thought I'd start with CES fun fact. You may have seen it in some of the publications, but there are 28 football fields full of exhibits, information, all sorts of cool things, and big applause for this crowd because you are here, so welcome. So my talk today is survival of the fittest, and my background is I'm fundamentally a venture capital attorney. I've had the true privilege and honor of being a partner at Cooley for the last 20 years. Was one of the founders of the San Diego office, and the reason in some ways that I come to digital health so naturally is we opened our office with 5 public offerings at that time. It was during one of the bubbles we'll be talking about. The first one was Qualcomm, and at that time I like to say it was really a struggling truck tracking company, all about satellites, nothing to do with CDMA or digital health. The other 4 companies were sort of the classic biopharmaceutical life science companies. And then I give Qualcomm a huge amount of credit because over the last number of years, as many of you know, they really have moved very strongly in being one of the founders of this digital health sector. So let's get started. The dream, we've all seen this. Increased efficiency, huge cost reduction, management of chronic disease, and most importantly, universal attention to prevention. So in the digital health world, what does this look like? This slide, I think, does a nice job of really capturing at the bottom part that which we've all talked about so much, which is the continuum between the consumer and the clinic, wellness and fitness and classic activity monitors to my left, and then off to the clinical trial and the clinical environment on the right. The bubble is an area where I'm going to talk a little bit about today because I think some of the most significant companies that have gotten a commercial story are in and around bringing both efficiency and transparency to 2 work streams. One of them is the whole payment work stream, in and around how money gets from somebody's pocket into the hands of the providers through one channel or another, efficiency, transparency. And then clearly the other is the whole delivery system, sort of how we have completely upended or are in the process of upending the delivery system. So what's our reality today? The car, 400 plus onboard sensors. The iPhone, 10 onboard sensors, 4 radios. Our reality, whoa. Annual checkup, how many people had their annual checkup last year? Not bad. And certainly no onboard sensors. So I like to look at the whole digital health environment along a continuum. And as we go from left to right on the slide, I start with what has been said in lots of corners, so none of this is new, but I think it's going to frame my conversation. The monitoring, sort of this basic, the sensors, the wearables, and in that environment, I think there's a real division. It's the simple activity monitoring and all the things that is attendant to that world. But the second is more importantly, or not more importantly, but a lot more difficult when you're designing a business model, are the devices that have chosen to be FDA cleared. And so we'll talk a lot about some other ones during the day, but AliveCore and TellCare in cardiac and diabetes are 2 great examples of monitoring devices that have been cleared, and they're now in the process of building business cases around that. Where I think we are today squarely is in the organize and analyze phase, and there's a lot of companies that we'll talk about that are in that arena. And then where we ultimately need to move is the action. This information, all of this effort, if it just remains point solutions, it's going to be worth little. But if we have the ability to drive some integration, drive some collaboration, and in reality bring contextual data to the whole area of digital health that leads to actionable opportunities, that's what it's all about. So, my talk. Is it a bubble? So at this point, I'm going to say yes. So this is where you should all reach for your Bing and give lots of, excuse me, I say no. It's not a bubble. It's here to stay. But let's look at a little bit of context. Down in the lower graph, this is the overall flow of funds into the venture capital industry. And as we all recall, at the very beginning of the century, we had an enormous flow, almost $100 billion in those early years of venture capital into the overall venture capital sector. We then had the burst. Yes, dogfood.com didn't work. Amazon did. But what was unique about that period is there was an incredible number of relatively new venture capital investors that were able to attract funding, and those funds pretty much got washed out during the ensuing years, as we all know. So we see that it's been moving along, but this year we had roughly about $20 billion, $30 billion, excuse me, $50 billion in last year that flowed into the sector. But importantly, about a little less than 10% of that went into digital health. So that gives you a little bit of perspective of the amount of money that's going in. It's a huge amount by digital health standards, up from about $1 billion in 2011, but still about 10% of the overall amount that goes into the sector. So my view is this is not a bubble for several reasons. There are those who are saying perhaps the valuations are getting a little bit lofty, and that'll be a debate, and we'll watch the ebb and the flow. The other thing that I think is inflating those numbers a little bit, and I think it's a good thing, is a lot more money is going into larger investment amounts into established companies. So you think of Proteus, you think of a number of companies that I'll talk about that have done substantial $50 and to $100 million type rounds. That's what drives those numbers. And there's not quite as many of the new startups, although there's a ton of activity down at the incubation level. So it'll be curious to see how many of the incubated companies move to the next level. But the second thing that I would call out is the quality of the players. So Rock Health publishes every year, and there are several others that do this as well, the list of the most active players. And if you look at the players on this list, you see a couple of things. First, you see some very established old line venture firms, Wainwright, Sequoia, Kleiner. And these firms are interesting for a number of reasons. First, in my view, they go back to the day when the venture business was a craftsman business. You craft companies, you commit to companies, you invest in companies. But more importantly, those funds have crossover talent, where they have an understanding of both the life science world, a la Amgen, Genentech, but also the digital and broadly technology world, a la Cisco, SaaS software, enterprise software, and the like. And so a lot of depth of expertise has come in there. But the other ones that are interesting here that are also game changers are Qualcomm Ventures and Google Ventures, just as an example. And these are the strategics that are moving into the arena. All of these slides I'm going to show here are a little busy, and at another time, when I have more time, I'll be able to go into some very interesting data you can pull from this. But what you see across the top are who some of these strategic investors are. You see Qualcomm, you see Google, you see Ascension, you see Merck. So you're seeing both technology companies, you're seeing delivery companies, you're seeing payors. And all of those are some of the big players that we're seeing today. If you then go to the venture capital world, you're seeing who these big players are. So Norwest, Kleiner, Social Plus Capital, West Investment Fund, Venrock, Coastlaw, NEA, Sequoia, Andreessen, Aberdare, Matrix, the list goes on. And if you look at some of the companies that these folks have all invested in, you're seeing a lot of crossover investments where not only are you seeing the venture groups crossover with the strategics, but you're seeing a lot of podding of investments along the continuum that we talked about. So my talk today is about survival of the fittest. And if you look at some very fundamental questions, the people, the companies, so the people at the core that have the capabilities of attracting the dollars, and it's a very sophisticated group of entrepreneurs that we're seeing, together with the best of breed venture community, are putting together a group of companies that we look at today. So you see here the groups that have raised more than $50 million. So Fitbit, Doximity, Best Doctors, Misfit, Welltalk, ZocDoc. You look at 100 million plus, somebody like Proteus that has done a phenomenal job of marrying the pharmaceutical industry to one of the, among many things they're working on, the ability to monitor compliance, whether the patient is actually taking the medication by a digitally tracked medication monitor. Solterra, one of the early monitoring companies. Oscar, some people say they shouldn't even be in the list because it's an insurance company. Teladoc and others. But what's interesting, and we were talking at one of the receptions last night with one of the lead VCs in the arena about whether there's going to be some consolidation. My thesis is consolidation in this sector is going to be good, and my other thesis is all of us need to help these acquirers be successful, whether it's, and we'll stand back and watch, but some of the big groups like Samsung, like Google, like others that have declared this as an important area, as you start to see them aggregate these companies, we hope that it becomes a successful set of aggregations to the extent that those are some of the companies that are moving into the field. You're also seeing some of the providers do it as well. And then, of course, there's been the recent IPOs, and I'd call out Viva and Castlight as two interesting examples, both multi-billion-dollar valuations. Viva clearly has been able to maintain that, and it's a lot about this organization and analysis theme that I've talked about that crosses over a lot of the topics. And people have talked a little bit about why did Castlight end up falling in the aftermarket. My view is it's still an incredibly solid company, and as we all know, the markets will go up and the markets will go down. So let's move on a little bit, and what I'm going to try and do is I'm going to do a little deeper dive on two topic areas. One is in the monitoring, and then I'm going to really try and take one single company example and move into a more in-depth analysis of what does a survivor look like. So here's in the monitoring arena, we've got, as I talked about, wearables and FDA-cleared sensors. I think this is a very interesting graph because in the monitoring or the tracker area, it shows all of the directions that these devices can go. So you've got the simple activity tracker at one angle, you've got prescribed medical devices at another, you've got productivity extenders at another angle, and then tribute to Misfit and others, fashion accessories at one end of the continuum, and then look at Samsung. What they've done is a very sophisticated watch that's been announced that has a lot of advanced monitoring capabilities. What's interesting about the Samsung device is on the left, that's a little insert that pops out of the back of the watch. So underneath, it pops out if you haven't seen it. And that is an open architecture that they're opening up to developers, and the whole notion is it's trying to get this platform more fully enabled. So let me now focus on the one company that I'd like to go a little deeper on. So this is an organization, an analysis company, and the company I'm going to talk about is Airstrip. This continuum shows you a little bit, again on the left, the more consumer-oriented Google Fit, the activity trackers and the like, and on the right, those that are going more into the clinical area with Airstrip and some of the things that Qualcomm is doing. So the environment is a fundamental shift in healthcare. We all recognize that today we're finding more patients, more provider consolidation, more costs and more complexity, and fewer clinicians and contracting or a more challenging path to payment. So what are the healthcare enablers in the overall picture? We've talked a little bit about it, but we've got the health monitoring devices, we've got mobility, we've got analytics, and we've got visualization. And I see Bob Akmani in the audience. I get to credit him for this slide. So you can see that there's a lot of companies, and if I clustered those companies, I could cluster them in each of these areas. So the real question is, how do you get them to have an organized solution so that you can deal with contextual data? Well, let me give you one example, and this is the Airstrip example. So what they have been able to do is they've been able to take all of the inputs from the various environments, and they've been able to put it into a single data platform that allows either the medical professional or the at-home caregiver to have all of the contextual data. And this is about as simple and organized as you could hope to have it. This also is a company that has raised, it's in that $100 million plus category. But let's just take a look at what this screen tells us. First, it gives us the basic demographics about the patient, age, rank, and serial number. Talks about what allergies. Talks about who the care team is. And this poor sucker has CHF, diabetes, hypertension, and, oh, by the way, a tobacco addiction. You have real-time waveform monitoring coming from medical devices in the clinical setting. You have an indication of what the active meds are. You get clear readings of the vitals. You have all of the imaging reports and results. And then in the lower left-hand corner, you've got documents, progress reports, and procedure history. Well, this looks incredibly simple, but let me tell you, it's not. Let's use an example of a great hospital system that in January of 2014 had maybe $2.5 billion worth of revenues, and they were operating entirely on the Cerner platform. Cerner's done a terrific job of integration, and on balance, for the clinical hospital setting, you can get a lot of interoperability with the monitoring devices, the classic, as Jill was describing, old world sensors and monitors that you see in the ICU, whether it's oximetry or blood pressure, so on and so forth. You have EMR, you have all of these sorts of things. But imagine what was happening in the boardroom January of 2014, and they said, we either have to eat or be eaten, survival of the fittest. So over the last year to January 2015, they went out, they acquired 3 new hospital groups. They've moved from $2.5 billion to call it $7 or $8 billion in revenues. They also went after a group of 27 aftercare facilities, and now all of a sudden they've got the classic rat's nest. They've got Cerner, they've got Epic, they've got all sorts of things that just really do not work together. So this is the problem that Airstrip encountered. They found multiple data types, multiple vendors, multiple caregivers, multiple clinical environments, and lots of form factors with no integration. So here's what they went after. They basically created this mobile interoperable platform that enables care collaboration and serves as the catalyst for innovation. What they did is they invisibly, so it all shows up on the pad, but they have been working on solving the mess, the rat's nest, to bring all of these devices, data types, the settings, whether it's pre-hospital, hospital, post-acute, and then lots of vendors, Philips, Epic, Cerner, McKesson, the list goes on. So survival of the fittest. They started with sort of a systems-driven technology where there's no interoperability, very complex workflow, lots of proprietary apps and systems, and they figured out a way to deal with all of that in the background. They then moved forward with a patient-driven technology where they had this single mobile platform. So how did this happen? This is the slide that I love. So this is $100 million of investment. You can imagine being in the boardroom when the CEO, Alan Portela, presents to his board, I want to spend a bunch of this money that I've just been able to raise, moving from what started as just a fetal heart rate monitoring, and I want to do this huge platform play, and I got to build it and see if they will come. Well, they started first by having both investors from the venture community as well as the provider investors. There were 79 innovators, 183 early adopters, 473 what he calls the early majority, and 680 in the late majority. So today they have about 25% of US hospitals and about 1,400 sites. But what you have to appreciate is this is almost back to the days of Qualcomm and the early satellite truck tracking. This company is incredibly early in the process. So how has this happened? They're now in 300 plus hospitals. They've got 30,000 plus clinicians using the platform. And then as you see on the left, they've got some of the best investors in the business combined with some of the healthcare providers. So in closing, where do we go from here? I'll just say the obvious there is, Airstrip is just one of many examples. I could have pulled out any of, probably 15 companies, each in a different perspective, but I think it gives you the idea of why this is not a bubble and why some very serious companies are being built. So in closing, what I would say is that where we are today is we're just beginning to mobilize what I would call the surface analytics, the things that have already been there. Nothing new, nothing too innovative, blood pressure, oximetry, cardiac. Where I think we're going to go next is we're going to go to the deeper levels of understanding that we have not yet begun to touch. So genomics to me is a huge area, and we're seeing with the human genome and what's happening with Illumina and others that we're finally getting the, what I would call the genome and the 6 billion base pairs is the parts list, but we don't have the instruction manual. So we're just now beginning to understand what the genomic and genetic variants mean and how we can lead those to paths of treatment. Similarly, we're looking, in my mind, to more ambient ways to monitor. There's lots of ways that you can think about it, but so that you don't have to worry about the earlier person that was describing how complex it is to get into these hot cars and get them all situated. So in closing, and I credit Eric Topol again for this slide, so thank you. We're looking that this is soon the old world reality that humans do indeed have built-in sensors. And with that, I thank you very much for joining us and hope everyone has a great day.